get started. We're at 12 o'clock. So good afternoon, everyone, and welcome to the second Timoney alumni panel discussion on leadership in turbulent times. Thanks also to those of you who joined last week and gave us feedback on the first webinar, which it was great to hear how useful it was for you. Our purpose with these webinars is to support you in your leadership role, as well we all face these what is you could aptly describe maybe as a challenge of a lifetime from different perspectives. Our panel of alumni this afternoon are all involved in keeping the show running, so to speak, in keeping us healthy, in keeping us communicating, supporting the communications network, and indeed in helping businesses with financial advice. So we're very grateful to each of them for taking the time out with us this afternoon to share some of their insights and experience with us. First of all, to say Professor Karen Redmond, who's consultant thoracic and lung transplant surgeon at the Mater Hospital. And Karen specializes in the surgical management of patients with lung cancer and end-stage lung disease. So just Karen, top line, how are we doing? Are we anywhere near turning the corner before we go on to introduce the others?
I don't know, and I think most consultant specialists out there will probably say the same thing. I feel that the mortality rate is lower than expected. So if you look at the UK figures, we should be about 50 to 60 deaths a day, and we're still running in the low 20s. And a lot of those deaths may be related to the 100 plus clusters in nursing homes around the country. But we are getting a mix of patients in, unfortunately, people in their 20s through to people in their 70s who are very unwell. And as these stories unfold with individuals coming in, you suddenly realize how people possibly have exposed other people to the virus. And so in some ways, we liken it to a bit of a tsunami. We're just waiting for it to happen. But it's given us a bit of time and an understanding of what was going on in China and Italy and Spain and Korea and places like that. We've been sharing international communication lines and pathways and expertise to scale up, to prepare. Right. So normally the intensive care would run in the Mater, but we have scaled up the high dependency unit to intensive care, the cardiothoracic high dependency unit to intensive care, the recovery in theatre is scaled up to an intensive care. The different theatres now run in a different format to facilitate people downing and doffing their PPE before they do cases. Right. And we're just slightly concerned because of this testing for COVID is probably not as much as we would hope, and the sensitivities are about 65%. So you might be COVID positive, but test negative. And I suppose in the earlier phases, people didn't quite understand how high viral shedding can occur in the asymptomatic phase, just before you become symptomatic. Right, yeah. Unfortunately, there are a lot of people may have been caught even within the healthcare sector. A lot of healthcare workers have got caught by not necessarily patients, but by their colleagues. And a circle went around yesterday that a number of, I'd say maybe 12, 15 doctors had to go out because of one person testing positive. So it's had a bit of an impact on service commitments because the staff are out either sick or isolating.
Well, for those who were on the webinar last week, we'll have heard Martin Tierney from Seeding Matters talk about his endeavours in coming up with different solutions for particularly in the personal protective equipment area. And I know, Karen, you were very much the catalyst for involved in that discussion with Martin, which we might hear a little bit more about as we go on. So just to introduce Conor Flanagan, who's MD of Secto Services, which designs, builds and maintains communications networks. Many of us are probably realizing again just how dependent we are on the phone and broadband. It's coming into stark relief for us. And Conor is joining us from out in the wilds of Connemara, where he's out with a team fixing up one of the telecommunications masts. So thanks for keeping us all communicating, Conor. And then finally, Alan Farrelly, who's managing partner of Farrelly, Dawe, White Accountants in Dundalk, and is also board director of UHY International, the accountancy and consultancy network his firm is part of. So maybe, Alan, if I could just jump in with you first. I'm sure you're having plenty of conversations with clients dealing with the shock that we're going through in terms of business in particular, and trying to make tough decisions in a very uncertain time. What are the key issues you're seeing in your discussions?
I suppose, Ronan, the key one is cash flow. Everybody is very, very concerned about cash flow and the damage that being closed or downsizing or scaling back is having on cash flow. A lot of businesses now closed and maybe not having the cash flow to reopen. And this came up in the conversation last week as well, that whatever about the cessation of business, the reopening of business is going to be tougher. So, and if everybody just started at the same pace again that they slowed down at, I think that would be too difficult, because the scale up, people are not going to be ready. I think the issue of a lot of people not being able to get paid for services or products that they've already put into businesses, and those businesses are now closed or they're running at half pace or whatever. Mm-hmm. Impact of that is going to be very difficult. Getting people back into work and getting them back into speed, and that's going to be a challenge. Mm-hmm. So, an awful lot of concerns around cash flow. And I know the wage subsidy scheme is out there from the government, which a lot of businesses are appreciating and utilising, and that's been a saviour. But I think, what's going to happen in Q3 and Q4, and whether the government can still be able to, help companies through that period, remains to be seen. But very good article by Mario Draghi the weekend before last, which said, look, this is something that the governments are going to have to look at the back end of the year as to how they're going to support businesses. And that are going to be still in arrears with customers, suppliers, revenue. So I think cash flow is really the challenge for businesses,
And is in that respect, are there any key learnings coming out of it that might help us in preparing for future unexpected events like this that you'd be saying to businesses would be worth looking at?
Yeah, I think, look, you can talk about a contingency plan, Ronan, but I think you should be starting to plan and look ahead as to how your business is going to resize when it restarts. I think that's the first thing you need to do. Yeah. I think you need to start looking at the cash flow. There's a lot of benefits out there from EI. If you're an EI sponsored company, the banks are supporting businesses, and it's going to be very, very hard to get support if you're closed, mind you. But there are other government incentives out there to try and get people back on the feet. So a contingency plan, look at your cash flow and communicate not just with your staff, Ronan, but with your customers, with your suppliers and your bank.
And the bank, yeah. And Conor, can I switch to you? What are the kind of key learnings that you've picked up so far in keeping the business going? You're in the field at the moment, running the operation, continuing to keep it going. So,
yeah, I think, Ronan, it's been, I suppose, once we had clarity that we were categorized as an essential service and that our business was going to continue to, for the most part, to be running as close to 100% as possible. It was about setting up the structures as to how we were going to keep our own communication going internally. So we spent a bit of time thankfully in the very early days of this. We took a view that we had to legislate for worst case scenarios. So we looked at a number of areas. Our first thing we looked at was the robustness of our own internal communication network. If we had to send people home, had we adequate machines, had we adequate access to Teams or Zoom, had everybody, reasonably good internet at home, And you know, we supported that then with regular interactions with our IT department to all our people. And then I suppose we had to start looking at things like educating our managers and middle managers as to how to deal with their teams when they're working remotely, because you know, it's important when you take away the office environment, managers are spending more time on their own making decisions. So we had to give them the tools and the skills. So we put together a fairly comprehensive guide as to what's the best way to deal with people, because it's a different emotional prospect for somebody who's used to having camaraderie, who's used to having access to people at the next desk to help them out. So when people have to be more self-reliant, it has an emotional impact on people, and some people thrive and other people struggle. So we're doing a lot of communicating with people. We've ran a couple of online courses to help these managers. But it's for the most part, our business has continued, thankfully. Where we probably have shed a lot of the non-essential activities, but we've only had limited layoffs. We've reduced the working hours for some people, but for the most part, most people are at 100%. So it's about, you know, as Alan said earlier, it is about communication and about trying to give people that sense that they're a part of an organization. And we remind them regularly that, you know, they are a part of an essential organization. There's a lot of people, a lot of industries, a lot of the you know, the country is relying heavily now on broadband as a utility. So from that point of view, it's the one thing that connects a lot of people, you know, to their families and to, you know, you see last night on the news where maternity hospitals are using it to send, you know, or sending out video clips to their to dads of newborn children. So a lot of essential needs there. So for the most part, for us, we're working away, and it's so far so good.
Very good, very good. And Karen, you're obviously in an environment that it's understandably going to be highly stressful at the moment. A lot of communication needed, a lot of good leadership needed. How are you finding? What sort of learnings are you drawing out of this that you'd say would be helpful for others to know?
Well, the communication side of it, just thinking what Conor had to say, I'm part of we set up a WhatsApp group, and it's some basic stuff, such as it grew and grew and grew, and we've got people who are in the newspapers or lead politicians on it, as well as key kind of medical people around the country. But it can only take 258 members. And you may want to communicate with people, but maybe you want to communicate with a subset of people. So you can't necessarily communicate freely, because you don't quite know all the different members of the group, because there were a couple of admin people. And so you suddenly realize, you know, Minister Harris is in the group because he comes in and makes a comment, you know, or right. Paul Cullen from the Irish Times is in the group, or Keir Kelly is in the group. So it's small things like that you suddenly realize that it doesn't necessarily produce the need that you want. And maybe within the medical profession, we don't quite understand the services that are out there. But suddenly being able to have an opportunity where you could have 1,000 members in a group, and they all have a name and they all have a title, so you know exactly who you're dealing with, and or they have a purpose, and being able to select out some of the people when you're trying to communicate, you know, the new antiviral evidence that's out there around the role of hydroxychloroquine. You know, that may not necessarily be beneficial to everybody. And then the problem with that, then you get a surge of WhatsApp messages coming in. I would say I get a WhatsApp message every 30 seconds. Wow. And so you're trying to shift through stuff to decide what is useful that I can then recirculate to I have like an education forum for a group within the matter, or what is actually more relevant to consultants because there are contract issues. And so there's a concern around service provision. So that's just one simple thing that that people could look at going forward, that would facilitate people communicating in a kind of a reasonable, structured way.
Right.
But then I relate that back down to things with my children, being able to get them to communicate with people. I think I was recommended an app called House Party. I could not work at Redmond. I think my 15-year-old was better at it than I was. And I was really freaked out about elation because, I've got a 6-year-old and an 8-year-old. So, but then the other side of it is I've been using WebEx, which is being made available by the HSE. And I suddenly realised I would have people with chronic lung health, in wheelchairs and oxygen in Kerry. And I used to make them come up to Dublin to see me. Whereas in fact, people in their 70s can easily WebEx and video conference in. And I've been clinics where I would have somebody in Kerry and I would have their daughter who's a healthcare provider who can't see them, who's in another house. And I might have 3 or 4 members of the family WebExing into the one appointment, which is actually very useful. People don't have to travel. They don't have to take their day off work. And actually a couple of people can listen to that appointment and understand what's going on with their parents. Because you can't fit 8 siblings into an office when you're trying to have a chat,
And they're hearing it directly from you rather than secondhand.
Exactly, and that helps a lot. So I would say from that side of it, and then the other side of it is very basic communication. You might have seen it on the ICU in London last night, and writing their names on an apron so that you could recognise them, because they struggle to communicate one-to-one with the PPE. There's an issue around, these cubicles, which may be negative pressure for people who have COVID, and the nurse inside the room and the nurse outside the room, how you would communicate with each other. You picking up the phone repeatedly, which isn't a great idea, or are you using, some people have used walkie-talkies. We don't necessarily have the telecom systems in place for this. It was never
thought to be an opportunity there to be addressed.
Exactly, or things like opening and closing the door, touching the handle. There was an excellent joke about, I think, 2 Scottish men in the lift where they were trying to use voice recognition to get up and down the lift at one point. But so the whole how we manage healthcare settings, and I'm sure that applies to everywhere in life now, because unfortunately the virus is ubiquitous, and the virus, there's often 2 or 3 surges, and there is a possibility that it might mutate. So we have to realise that we may need to adapt our business so that people can work and stay safe. Yeah.
So in terms of the normality, getting back to normality, you'd see this not clear at all as to when that will happen.
It depends on a couple of things. It depends on whether we are flattening the curve because of social distancing. It means that the graft will go on longer. If we believe, however, that there's quite a number of people out there who have had COVID and either haven't been tested or the test isn't necessarily accurate, it's only 65% accurate, that there is quite a number of people who have been asymptomatic with the disease in China, and that they're saying up to 60% of people were asymptomatic with it, then Boris's concept of herd immunity will actually be an important concept to understand about getting people back to work. So I don't think the testing for COVID is key. I think the testing for immunity is key. Because if people can get a quick immunity test and they've had it, then they can go back to work.
Right, yeah.
And and unfortunately there've been, very young people have died from COVID. So it's not like we can send out the younger generation and say off you go and start working. I think you're going to have to bring in immunity tests to be really confident that people can go out there, do their job and feel safe.
Yeah. An immunity test, just, sorry, excuse my ignorance, but is that something that...
It's a blood test usually, although they might be able to do it in a different way, and they check for antibodies.
Okay.
Showing that you've had the virus. The way you might check to see if you've had chicken pox, or if you've had, vaccinations to hepatitis, whatever, when you start working, it's immunoglobulins they'll check in the bloodstream, and if you have them, then the perception is that you're covered. The thing with Ireland, though, is a lot of people have been BCG vaccinated, and there's a link now between BCG vaccination and how it works compared to people having a reaction to COVID. So, and in fairness to the epidemiologists, they've shown that.
Sorry, what was
BCG
that
vaccination is TB, vaccination for TB.
Okay.
So if you've had the two little indents in your arm, they stopped vaccinating around 2012, 2013.
Okay.
And in fact, I wanted my 3 children vaccinated because 2 were born in the UK. They weren't vaccinated, and my daughter was born in 2013. But actually, there's a worldwide shortage of BCG vaccinations. But they're showing now that people who've been vaccinated with BCG for TB are probably slightly more protected than people who haven't been. And Ireland used to be full of TB, didn't it? It's, all the hospitals are really built for sanatoriums for people with TB. So in some ways, that may help protect the Irish population more than places like the UK, which may explain why our mortality rates are less.
Wow. Okay, well, that's good to know. Good to have that in the bag, so to speak. Well, just Alan, could I switch back to you for a moment? What are you picking up through your international network perspective on? I suppose we know it's having different effects in different parts of the world, but from the economic point of view, are you getting any feed coming through your network?
Yeah, Ronan, we had 4 international calls last week just to get just to assess what was happening in different countries, and the likes of Bahrain, they're in a curfew, so they're even locked down more than us. So it's pretty difficult. In the likes of Kuwait, also in a lockdown. So people think we're just having a difficult time here. I know Karen's team must be under tremendous pressure, and we can only thank her and our team for all their efforts. Yeah. But the key is most countries are in the same situation as we are right across the EMEA that we looked at last week. Obviously Spain, the guys from Spain and Italy were on the call, and government incentives to try and keep business moving in the background. But the fear is there, and a wee bit of paralysis in some countries you can see. And I think you have to see the fear. I think it's right to see the fear, but I think you have to be able to deal with that and move on. And I think Timoney has always been good for that, Ronan, to let us see the fear and take on the challenge. Yeah. And I think as business leaders, it's up to us to show that leadership. So I think the key issue, and probably the most disturbing one, was in Germany, where the government have brought out regulations for SMEs not to pay any bills for the next 3 months, and the impact that would have. So I know our German friends were a wee bit disheartened now when those regulations came through, because they didn't know how they were going to keep the wheels turning in that sort of a situation of lockdown and no cash moving. So we're not that bad in Ireland, we have been able to continue to keep the wheels moving. And the Karen brought up one there about communication, and right across the network we try to use Microsoft Teams, Karen, and the likes of Slack. And in Slack you can have channels, so you can actually break your group down into channels. And Slack again is free, it's a very good service, and maybe one you can have a look at there. But you can actually have channels, so you're only talking to people that you really need to talk to in that specific channel. And we use it in our own office, and we probably have about 30 or 40 different channels, whether it be social, just the directors talking, just the managers talking, just the staff talking, or whatever, whether it's credit control. So you can actually decide who's in the group. So someone takes the leader, and then it's up to them to let people into the group. So that works
very, well. Very practical.
Yeah. So I know in the States were on the call with us last week as well. Big stimulus package in the States, $350 billion at this stage, US dollars, by way of government loans. But they reckon the loans will be forgiven, Ronan, at the back end of this deal. So let's hope that is the case, because that's a lot of money that has to be repaid otherwise, you know. But I would say, yeah, a lot of fear across Europe. Still no clear lines as to when people are getting back. A wee bit of change in Austria. Yeah. They are 50% of their offices back from yesterday. So, you know, where before they were in lockdown. Copenhagen, hopefully they're seeing a wee bit of a change after Easter. The better government had a talk with all with the people of Denmark last night, and they were saying, yeah, they're looking to maybe set back some of the lockdown procedures that have been in place the last few weeks. So after Easter, they're seeing a wee bit of relaxation as well. So
light at the end of the tunnel. Yeah.
And maybe a little bit of light at the end of the tunnel, you know.
Yeah. Okay. Well, Conor, just to switch back to you, it's been said sometimes in crises that leaders tend to revert back to maybe being more controlling or directive with employees and colleagues, maybe out of necessity. And yet at the same time, we know that, well, particularly with remote working and so forth, trust is really, really important, and to be showing trust as a leader. Would you have any thoughts on that from your experience over these past few weeks, and what advice you'd give other leaders to get the balance right?
I think the word trust is important. I think it's in a situation like this, it's not ideal, but it's a good calibration of your actual levels of trust amongst your team and your people. The one thing we've been trying to do is keep things as normal as we can in an abnormal situation. So the pulse in our business and the routine of our morning huddles, a lot of our business, you know, our guys are out all over the country. You know, there's crews everywhere, and to try and keep that regular communication going. Now, we probably do more of it, but we're trying not to make you know, as big a deal of the, you know, of the situation as it actually is. You know, Karen mentioned there a while ago that this could be something that could happen again later this year, or it could happen next year. And, you know, what are the learnings that we are finding now, or what are the things we're identifying now that, should we come out of this but have to go back into it again, what would we do differently? But the one constant really is that we have a group of people who interact with each other as part of their job on a day-by-day basis all year long. So we're trying to keep that as normal and as regular, and, you know, try and make this the norm as much as we can, and downplay the drama. There was a lot of drama about it at the outset. People were naturally enough apprehensive about continuity of their job. Now when we speak to we spend a lot of time on the phone ringing people and making sure they're okay, and we do as much as we can on Teams and on Zoom. But it's really around a lot of the kind of conversations that open with is, how's your mum and dad? You know, how is your kids? If some of the people might have a sick child that's in a precarious place. So it's really about that communication, that it's a person we're dealing with first, you know, that you're talking to first and foremost. So how are you handling this? How are you coping with it? And then you get into the business, but we're trying to keep it as normal as possible, and you know, keep going back to it. It's that communication. I would find my phone is probably, the battery is gone from 100% to 5% before 11 or 12 o'clock in the day, which is probably not good for my brain. But it's about just keeping that communication channel open.
Good, very good. Well, speaking of communication channel, I know four of us are having a conversation here, but there are about 84 attendees listening in who, if you'd like to ask questions, there's a questions feature somewhere on your screen, depending on the layout, the Q&A button, and you can pop a question up there, and in a few minutes I'll start channeling some of those questions to our panelists. But just Karen, to take up the issue that has been in the media with the personal protective equipment coming from China and so forth, and it struck me that there's this tension here inevitably in a crisis between having to act quickly and make decisions and pull the trigger, so to speak, and at the same time wanting to be calm and do the background checks and check out things. And would you have any thoughts or advice on that in terms of how to avoid procrastinating on the one hand, but at the same time make decisions that are timely and speedy?
Right. I think speed is very important, and I think if you are changing, what you do and producing a different set of products, that there is government legislation in place that can protect you to be able to deliver those products to people. As people talk about, are things officially approved? Have they got the stamp of approval, depending on the particular product? So with Martin was particularly helpful.
Would you explain a little bit about what Martin, because not everybody might be aware of what he did?
Well, with the biggest risk about viral load is intubation and extubation, because when people are being intubated or extubated, they can cough a lot. And we now realise that when you cough, you can basically throw out virus particles up to about 6 meters. Wow. And which is why, to some extent, people like the CDC in the US are advocating masks when you're out in the environment. And the other thing about coughing, these particles can be of different sizes, but in fact, they can maybe linger in the air for up to 30 minutes before they drop to the ground, depending on air conditions.
Wow.
And obviously, if those particles get out, then they can contaminate a number of surfaces in your work environment as well. And there's a lot of data out there that suggests that these virus particles can last for hours, if not days.
Right.
And I suppose we haven't been equipped enough around how to quickly and safely sanitize rooms after use.
Yeah.
So there's a bit about producing a box. It was produced by a group out of Taiwan, actually, and the design was freely available to people. And there were 2 people out up in Northern Ireland, including Martin, who's part of the ALP group, alumni group, who over 48 hours basically produced this box and put several prototypes out into Galway, Cork, and Dublin. And funny enough, the New England Journal of Medicine has just published about this particular box, showing with fluorescence dye how much virus can spread around the operating room.
Right.
So it not just affects the anaesthetist putting somebody asleep, but the nurse supporting him, or the nurse recovering the patient at the time of extubation, but also all the surfaces that can be contaminated for the next case coming through.
Yeah.
And the other thing about it is that there's definite evidence that viral load will impact an outcome, which is why there has been a death rate amongst healthcare workers, because viral shedding is quite high during aerosolized procedures, and the outcome is perceived to be worse in those cases.
Okay.
So so there's about 85 or 90 boxes being delivered to different sites around Ireland, and there's more being produced.
You shared a video of it with me.
I did.
There. Will I show that on the screen?
Yeah, just show it there, and you can see.
Yeah, just to I think this is it here.
And Martin at the same time had changed to making also visors.
Can you see that?
To protect people. So there's the box there. So you can intubate from the top of the table, and the patient actually will be on the table at the time.
Okay.
And it's referred to as a box shield. And there's been some modifications to facilitate bronchoscopy, scoping patients. And I think going forward, I think this will be used routinely even after the COVID crisis.
Okay.
But at the time, Martin also was making Pfizer's, which is basically shield over the face. And in fairness, he did link in with the HSE, but they hadn't come back to him. So I felt that at a HSE level, they needed to structure links with industry more. And in fact, then maybe a few days later, NHS had offered him a consignment of 1.5 million.
Very good.
So for looking at how we sanitize, how we protect people is important, but also looking at how we sanitize things is really important too. And I would think, you know, for businesses out there going back to work, you need to consider how you lay out your offices, you know, and you might consider decluttering. You might considering respecting the 6 foot social distancing mark when it comes to where you sit people in a room. You might decide that some people will rotate working from home. You might decide within your office structure how you clean it, what you clean it with, who comes in, who does a deep clean. Or, you know, for some groups who really, their industry relies on traffic coming through the room, such as, I don't know, restaurants or gyms or GP practices or whatever, they may want different types of quick sanitation options, such as UV room sanitation or hydrogen peroxide or whatever. I think there's different facilities out there. So you may decide that you will go into producing these products going forward, because a lot of people out there to get back to work will want to have these things available, because then when people are using their facilities, they'll feel safe. Supermarkets, pharmacies, gyms, restaurants, everywhere.
Do you see that as a long-term change, or is it just an immediate sort of solution to getting back on in this occasion? Or do you think there's going to be a shift towards greater?
I think there will be a shift towards it. I think people will be more mindful about that level of hygiene, down to the extent that you know, like I look at my own children going to school, they had their little hand sanitizer bottle, you know, but it never got used, you know. So how you will change what children carry around with them, like you would, you know, producing products for kids who have to carry EpiPens. You'll now start thinking about producing products for kids who might carry hand sanitizer. So it's, I think if you have a company that can adapt and needs to adapt during this time, I think there will definitely be needs within that area where you can potentially or hopefully produce those type of products. I think O'Neill's, for example, in the Republic, were producing material and coating it with antiviral properties, so that it went to make scrubs for people in the NHS. That's
NHS, right? Are we accessing them here in the south yet from O'Neill's, or is it?
No, I've struggled with trying to understand, you know, within central government, you know, what are the exact needs, and are they quite actually coordinating that centrally so that they can feed out to different manufacturers or people in industry what's required.
Yeah.
So
I think we lost you there. Alan, could I just bring you in on the point that Karen is making there about collaboration?
A lot of
Sorry, we've lost connection.
Consultants will be getting calls going, I have a do you want me to start printing masks? Like,
we're all right. It was great to have our meetings up in Strabane, working with the NHS, Randux in Antrim, also doing the testing kits. So, yeah, look, I think there's a lot of Irish companies out there that are going to adapt, they're going to change, they're being innovative, and they're coming forward and assisting the HSE, their NHS. It's fantastic to see it, and hopefully that collaboration will continue.
Mm-hmm.
I think the policy in the UK was to make it British. I think in Ireland we have to make it Irish. I think that's key. And then you know what the product that you're getting is the product that you need. you know, so there's security in that as well.
Yeah. Just on that question, I suppose, of collaboration, more collaboration within Ireland and within businesses in Ireland. What do you think, Alan, could be, how could we encourage more of that? I mean, we've seen a very good example with what Karen and Martin Tierney were involved in, but there seemed to be an element, I know when Martin was talking about it, of contacting different people around a need, and then there was an energy there. What would you think about how we could encourage more collaboration among different businesses?
I think Irish business are very good at naturally collaborating, Ronan. I think what we need to do is understand more the needs of what people want. I do see it a shame that, you know, the HSE have to go to China to get all the product that we need. When we could have asked people locally to do it, I think we have loads of resources in Ireland that could have adapted. You know, and it's a pity we don't put the message out there. We have systems in government where there is a procurement policy in place, and I think all those things need to be looked at again, Ronan, and we need to look at, as Karen says, like trying to keep it as Irish and work as an Irish group. And we are very adaptable in Ireland, as Martin showed last week.
Mm-hmm. Mm-hmm. Very good. Conor, would you have any thoughts on that?
Yeah, look, I think one of the things there, I in a previous company, we did work in FDA regulated environments and calibrations and things like that. Just interesting to see on the news recently that the University of Limerick were working hard to come up with a testing product that's in short supply, and it seems that they were able to move it through a validation process very, very quickly. And I know that whole validation piece, and to be fair, Karen will speak better on this than I would, but I think we can show that, you know, we do show that when we need to do things, we can do it. But I do think in terms of collaboration, we've been sort of looking to see, right, we're a service industry, what else can we do? Is there anything else, you know, along what Martin did last week or in the last number of weeks? That's incredible. It's harder when you're in a service industry. You know, there's probably limits to how innovative you can be to impact something quickly. But apart from Timoney, I haven't really seen a huge amount of traffic in terms of having these type of collaborative forums, which gets people thinking and talking about where one company can help another out in order to enable a solution to help in a situation like this. So first of all, well done to Timoney again for being creative here. But yeah, I think I'd reiterate what Karen is saying, that from a point of view, we've become very stiff and very very, very slow to react to what is needed. He tends to be over the top. So yeah, I see the need. I'm not exactly bursting with suggestions, but
suggestions, yeah. One of the documents Karen sent me just there over the weekend was from a Professor Liang in Zhejiang University of Medicine in China, and he made this comment that the real remedy for this pandemic is not isolation, but cooperation, and that the war has just begun on that. So that whole idea of kind of cooperation, which is, I think, is there's so much potential in it if we can somehow implement it. There's been quite a few questions coming in, so I won't move to that. I'm apologise in advance, we won't get to all of them, but if I can pick out a few that have been asked and share those with our panel. One was for you, Karen, which was, how does the public-private issue work with consultants? She's just commenting to surgery herself, but you know, if she requires to contact her consultant, is the system different now?
But that hasn't actually been fully resolved. I was quite disappointed that when they were trying to work through the needs for people nationwide, that they didn't bring in the IHCA or the IMO, they're the licensing bodies for consultants. because consultants aren't employed by, well, most of them aren't employed by private hospitals. They are self-employed and they come in. I think there are contracts that are under negotiation at the moment, so that might facilitate some people to continue seeing patients privately. I think people think it's financially driven, but it's not really. I think most consultants who are full-time private, they kind of run small businesses themselves. They might employ is about, for an individual, it's about 4,000 a month,
Right.
So even with the wage subsidy in place, between your outgoings and stuff like that, it's nearly impossible to keep going
Right.
with the type A contract. So if they had their vouched, expenses, dealt with or something like that. The other thing I think for consultants, they just need to make sure that they have the medical indemnity in place in such a way that they are protected. And I think they want to be able to go out and to work in hospitals, but they want to make sure that if they're working there, that the PPE is in place.
Yeah.
That they have that.
PPE is a key thing, I suppose.
It's key.
Yeah.
I think people feel very uncomfortable that it hasn't been resolved for people who are in full-time practice, because they want to be seen to be doing their bit, ethically.
Sure.
But one part of the contract, I think, was things like sick leave. Like if you have a 3-month contract with the HSE, you get sick on week 11 because of a COVID-related, they keep going and look after your employees while you're waiting to get back to work. So it just wasn't really managed very well on a national level, which is a pity, because the healthcare system, it's half of the healthcare system is private. So at the moment, I think some of the private hospitals can't actually do any procedures because they've no staff to run it. Like, I can't do an operation in a COVID negative hospital at the moment because I don't have an anaesthetist, pathologist, radiologist, even though they're coming in as public.
Yeah.
So I think once that needs prioritization to get that resolved. But there is every consultant has a duty of care around continuity for patients, that they can continue to provide that care, and it's important that if that particular individual, if they're concerned, they should deal with their consultant individually, I think, if it's a particular problem.
Okay, and Alan, there's a question in here for you on the state of the economy when we get back up and running.
Right.
And the fact that we're coming out of a recession, and we're well out of it, I suppose, but we're still suffering some of the side effects of that, just getting back. And here we're going to be faced with another one. It's from Philip Clark.
Yeah, it is a difficult one, Philip, because we're still dealing with everyday finance, and we're still dealing with all the other vulture funds that are there. And even yesterday, I must have had about 6 inquiries in from them looking for further information on people that we're still dealing with from the 2008-2010 crash. So, I don't know, is it ever going to end? We weren't even out of it, Ronan. So many people, they're still suffering, dealing with vulture funds and having receivers appointed, and unrealistic expectations being set by the vulture funds. So that's still a challenge. It remains out there. In terms of the hit on the economy, I think Europe is going to have to come in, and we're all in this together. And we can see that in Europe they are struggling to come to terms with this. Obviously, France and Germany maybe don't want to support Italy and Spain as much as they need to now. I think that will get resolved, and when that gets resolved, I think the impact for Ireland will be good. So they are going to have to come in. The government have come out on the subsidy scheme and the unemployment benefits. Huge numbers in the paper, 700,000 people saying they're out of work or claiming benefit. Yeah. It's not actually true, those figures. And I think when you read back, you might see there's 300,000 people out of work, 400,000 maybe on the subsidy scheme. That means a lot of those people are still being employed by their employer. They're still working for their employer. It doesn't mean they're on the dole. They are getting benefit from the state. So it's probably not right that figures are reported that way, and I don't like to see them reported that way because it exaggerates what's in the system.
It's hyping it. Mm-hmm.
Yeah, so I think, there's 3.7 billion set aside for that. There's no doubt there's going to be a couple other, many more billions. So I think, I saw a number last week, knocked around that it's going to cost about 10 billion, Ronan, maybe 11 billion it's going to cost. The government factored in so far. So instead of showing a surplus of 2 billion for the year, which was the budget, that they're now running at an 8 to 9 billion loss for the year. Will that be funded by Europe? We cross our fingers and hope our friends in Europe will help us through this one,
Or maybe by Apple.
Well, I think that's a big challenge, and our friends in one particular party would like to see that money used. But I'm not actually sure, Ronan, we've actually got that money, have it ring fenced. It might be still on Apple's balance sheet.
Yeah, probably. Yeah. Conor, a question here for you about seeing as you're continuing to operate. Are you encountering any difficulties getting materials or equipment that you need? Like, what's the supply chain?
That's a good question. For the most part, it's okay. A lot of the equipment we use is it's project related, and it has been procured already by our customer for the projects. We are seeing certain areas where we do some civils work. If we're reinstating tarmac Adam or something along a public road, the closure of the construction industry has obviously meant that the quarries and those providers of tarmac and things like that are at a limited production. So that's a potential risk. But for the most part, most of what we need, we can still get. We did see most of our customers react positively at the very outset of this, and they loaded up on what they needed. But yeah, there's no impact for the moment, and the intel from them is that we have sufficient equipment to keep installing, and the spares that we carry for critical breakdowns, so telecoms, transmitters, dishes, things like that, we're okay. We're not seeing any major impact.
Great. That's good to hear. It's certainly supply chain seems to be performing well in general, with the exception of this important area of PPE. But just back to that, Karen, we have a question here from Terry Smith from NUIG in Galway, did our program last year. And he's just bringing up this point about cooperation. And they have offered to support HSE West in terms of making and supplying virus lysis buffer, but they haven't had the offer taken up. He was making the point that expertise across Ireland is available if it's asked to solve the reagent supply problem. So do you think that a coordinated HSE-led initiative to be put in place to increase the tests, reagents, versus?
Yeah, I mean, I think that's critical. I think they need a lot of project managers dealing with different needs, and basically supporting and directing and supporting local industries to do that over a reasonably quick, time frame. For me, I didn't feel I was getting the right feedback, so I've linked certain people in with the people who are directly in procurement in different hospitals. Mm-hmm. But obviously, if they purchase out of the hospital fund rather than purchasing centrally. But certain procurement groups have opted to do that. And I suppose people are running individual fiefdoms around the country, maybe linked to universities or otherwise, to develop, innovate and supply. But I think that level of coordination centrally is lacking.
Right.
And also, it's not just about getting orders in and being commissioned to do something, but it's understanding that if you produce a product, that it can be validated and go to market quite quickly, and how can industry be supported to do that?
Yeah.
I suppose it's I appreciate where Terry's coming from, but I've had a couple of similar issues, and I've probed about getting who the key people are in the HSE that people can communicate with.
Yeah.
But I've had colleagues of mine that have had similar experiences. So I think if people have influencing positions out there, I would think coordinators or project managers within the HSE just focusing on this particular need, is really important.
Yeah. Okay. Good. Well, hopefully that'll be.
I think they hoped that the Chinese batch coming through would be enough, but I don't think that has been the case. No.
Okay. Very good. And Conor, there was a question here just from Martin Tierney himself about the advice or training that you might have given employees on working remotely, and have you given any sort of tips or practical ideas that you could share on the remote management people?
I'd be happy to share that with you, Ronan. You can distribute to anybody. It's really, we looked at it from a point of view of some people, as I said earlier, react really well to working in. They're happier working in on their own, but for others, it's difficult. So we focused on kind of breaking it down to tasks and saying, okay, look at your manager, that there's communication every morning, and the specific tasks that are required to be done before the end of close of business today are defined and are made pretty clear. That they stuck to the task, and then the next morning you follow up, or that evening you follow up and see how things have gone. The other piece, I suppose, was around identifying difference in one person versus another and adapting the approach, because some people will just be happy to say, look, I know what I have to do, leave me at it, and I'll come back when it's done. There's a good bit in around, I suppose, reassuring people and giving people a sense of, there's a lot of people with concerns, natural fears for their employment and of their health. So there's a bit of counselling as well, in a kind of high level way, just asking them, are they okay? It really, there's a couple of key pieces, but it's mostly around, is the person comfortable? Are they still feel enabled? Do they still feel a part of the team? And are they appreciative of the part they play in making sure that we provide that service to our customers, who can provide that service to the end user, to industry, to education, to health, and so on. And it's to remind people that, because it is, everyone has the same challenge working from home. You're kind of feeling, well, I'm not talking to anybody, and am I really still relevant? So it's really about keeping that relevance and reinforcing them of the importance of what they do, and just make sure that they're happy in their own mind as much as anything else. But I'm happy to circulate. There's I think 12 points on that program, so I'll circulate with you and
that'll be useful. Yeah, very good, thanks. And then maybe just finally, Karen, there's a question here from Ronan Morris about your personal opinion on masks and I suppose even the use of homemade ones, how effective they might be. Do you have any thoughts on that?
I wear a mask going to the supermarket and going to the pharmacy. I've pushed very aggressively, as have people like John Crown, on a national level with different forums. The WHO haven't quite agreed, but I think the CTC have agreed that public wearing masks may help. There was data that has come out of Hong Kong that's probably a bit more conclusive about it. For me, I wear it because as a healthcare worker, I suppose I'm at higher risk, so I do not want to expose people where I might be shedding the virus, but I'm asymptomatic. So, and the other thing I would note is that when you go into shops, even where there's quite a bit of regulation about who comes in and out and the number of people in the shop, it is very difficult to keep 2 meters apart. It's practically impossible.
Yeah.
And my worry is obviously if somebody talks to you, they can shed a little bit of the virus. If they cough, they can shed more. And then there was a concern that it may actually be in the air for a period of time before it drops to the ground. So you might walk through a place where somebody with this virus has been coughing prior to walking through. So I would wear a mask. That's my personal opinion, that I would wear a mask if I feel I cannot keep the 2 meters social distancing, which is quite difficult at the best of times. Even in the canteen in work, there's been an email sent out, amongst healthcare workers, despite the fact that, there's only going to be so many people per table, and people, like 2 meters is quite a distance. And so I suppose I was fighting more for healthcare workers to be wearing them in work, even in what they refer to as cohort areas that don't directly have COVID, but there are rooms linked to COVID patients, or even non-clinical areas, because I felt healthcare workers are at a higher percentage and a higher risk. And I'm more likely to get it from a healthcare worker that I don't suspect than a patient.
Wow.
So that's been more my fight. But I think at a public level, I certainly think that if you cannot keep 2 meters from people at this point in time, I would wear a cloth mask.
Fair one. Okay, very good. Well, look, we could carry on this very interesting discussion. Let me thank our guests, because we've reached our time. Karen Redmond from Mater Hospital, and Conor Flanagan from Secto Services, and Alan Farrelly from Farrelly Dawe White Accountants in Dundalk. I hope you found it as enlightening and insightful as I have. And thank you all the attendees who've joined us. I think it was up around the mid-80s at one point, which was great. Just this day next week, on the 14th of April, you may like to join us for an online session on negotiation in crisis management, which IESE Professor Kandarp Mehta is going to be delivering on Tuesday afternoon. Kandarp was teaching on our program there the year before last, came here to do a masterclass, and he'll be running a session on Tuesday afternoon. We'll be back hopefully with another webinar on Tuesday morning, and we'll send around details about that. But in the meantime, you may like to touch into the Timoney Connect platform, where you can connect and collaborate maybe a bit more with other alumni, and see how much more we can achieve together over the next couple of weeks as we face this kind of critical time. It sounds like we are facing into a fairly grim bit of news over the coming week or so, for those who may not make it through overcoming the virus here in Ireland and elsewhere. So certainly our thoughts and prayers are with them as they face that. But to end on a positive note, we're also approaching Easter Sunday, which has a profound message of hope for Christians across the world anyway, and may it fill each of us and our families as well with some hope at this time. So thank you very much again for joining us, and look forward to seeing you again.